Well, the Ministry of Health held a press conference which wrapped up about half an hour or so ago, giving an update to the public on COVID-19. Our Jiminy DeSwain was there and has this report.
While there are 3 confirmed cases of COVID-19 in the Bahamas, Health Minister Dr. the Honorable Dwayne Sands noted that those numbers will increase. During a press conference Wednesday afternoon, he explained the mitigation plans health officials have in place.
You will begin to see increased numbers of health personnel from the private sector working together with the public sector to respond to the needs of our brothers and sisters. I ask that you pay attention to the health messages from the Ministry of Health, so that you understand how the virus behaves and the actions that we must take. The next step will be the investigation of this virus's impact on Bahamian residents and the success of the actions we take in response to the outbreak. Since this is a new virus, information is likely to change as we learn more and more from other countries and people who have had coronavirus, and also from our own experience.
Deputy Chief Medical Officer Dr. Dalon Brennan notes that the additional cases are linked to the first and that contact tracing continues.
The issue is, as you begin to widen your circle, you get an idea as to whether these new cases of people either having symptoms on the outside that have traveled or related to your new case are all connected to each other, and that's a part of what we do as a public health measure. The issue is, as we begin to address our issues around the individual case, we also need to figure out what we need to do from a public health aspect to make sure that we don't continue to spread the infection around the Commonwealth of the Bahamas.
Now, health officials note that those call numbers are being utilized by the public for additional information as it relates to COVID-19. The health minister also outlined plans as it relates to testing in the Family Islands.
Specimens will be taken from them. They are then flown to New Providence, not the patient, the specimen. And the specimen is then examined and the test run. Now, if somebody is so ill that they require hospitalization, not isolation or quarantine, not the 80% plus that will have mild disease, if you are sick enough to require hospitalization, we will come and get you.
Again, health officials encourage members of the public to practice social distancing, that is, staying at least 3 to 6 feet apart, conduct proper hand washing, that is, at least for 20 seconds, and don't conduct any unnecessary travel. At this time, they're hoping to keep the numbers of COVID-19 cases at a minimal in the country. Jiminy DeSwain, ZNS Network News.